Welcome to the Voices of Dental AI, the podcast exploring how artificial intelligence is transforming dentistry. I'm your host, Loren King, Chief Evangelist. In today's episode, I talk about the future of dentistry and the story behind Isaac, our groundbreaking dental AI. Let's dive in.
Right, Bernard. Thank you so much for being here today.
Hi, Lauren. Well, excited to be here. I am excited to be on our own podcast, The Voices of Dental AI.
Voices of Dental AI. Doesn't that just sound good?
Yeah, that does sound great.
This is episode 1. What better way to start than one of our founders and the CEO of Trust AI and Isaac? For our listeners, can you tell us just a little bit about yourself in your own words and what led you into the AI space?
All right. I'm actually a physicist. I have a PhD in physics, and for the past 10 years, I've been an entrepreneur. I ran 2 VC-backed companies in the areas of AI, autonomous driving, and robotics. And over the years, I raised $100 million for various ventures.
I think that's great context, especially for anyone that doesn't know you. But if you've built AI solutions across different industries, but dentistry is a very unique space, right? I'm sure you're learning that very, very quickly already, being in dentistry and seeing how we are and seeing how we operate and how we think. What gap did you see in dentistry that Isaac was uniquely positioned to fill?
This is an interesting question. I'm going to start with what we call my personal catalyst, which is a reflection of industry reality, and then I'll talk to you about the sort of what I saw. Personal catalyst. It actually started with my own frustration, the fact that I couldn't get timely responses or appointments from my own dentist. My own dentist would probably bash my head if they
We're
if they
sorry.
see that recording. But it is the reality today, like hygienists and dentists are juggling multiple balls and they can't possibly attend every call or text message. And we've heard that like multiple times across dentistry. At the very least, not on time. So I ended up building an AI receptionist first and quickly realized that the problem was much deeper. And it's stemming from having conversations with my co-founders. There's a whole backstory, which I'll skip because I want to focus on the message. But what I discovered is that dentistry is drowning in fragmented, labor-intensive processes. Patients don't trust dentists, and there's a need to access quality mentorship. So now there are 3 things I want to talk about. One is what we call the clinical intelligence gap. So dentists, if you think about dentistry, dentists are in the process of decision making. So they are making, and often they are making complex decisions in isolation. They have no instant access to specialist level knowledge when they need it the most. And also, unlike other industries that have AI assistants, dentistry was or even is still operating like it's in 1995. The fragmented tools, manual processes, zero intelligence. That's the first gap. And then the second one is the labor crisis no one talks about. So if you think about practices, they waste like 40% of their time on non-clinical work. So insurance verification, documentation, inventory, tracking, and also patient follow-ups. So now we're not only talking about inefficiency, it's forcing dentists to choose between sustainability and patient care. And that's the sort of the second piece. And the third one is, I think we are on the verge of what we call the iPhone moment for dentistry. Just like smartphones replaced 20 plus separate devices, we saw that one AI brain could replace dozens of disconnected dental software systems. And this is, sort of the other gap. We see that gap and we see that a winning solution will not be another point solution. It would be like a universal operating system that makes everything else obsolete. So if I had to sort of summarize, I realized that dentistry needed what every other industry, a lot of industries already have. It's this central intelligence that handles the routine so humans can focus on what they do best. We want to build a foundation that every dental practice will need to survive tomorrow.
I think that's a really interesting view of someone, especially coming outside of dentistry, right? So you more so have the patient viewpoint than you do what most tech companies in our industry have right now, which is they're usually dentist or in the dental field or something like that. And I know personally, just working for you, it's already different because you have such a different outlook coming in to an industry like dentistry that is so special and unique and niche. But when you look at the landscape, there's definitely going to be other AI solutions entering dentistry and that have already existed in your view, what makes Isaac fundamentally different from those, the ones that already exist and the ones that are probably coming?
That's another great question. I mean, there are four things that makes Isaac truly different from other AI solutions. The first one is it's the first true dental native AI brain. If you look at other companies, they are adapting like foundation models or generic AI for dentistry. Isaac was built from the ground up for dental workflows. I mean, it's trained on dental protocols, real-world studies, and most importantly, gets continuous feedback from specialist dentists and not just computer scientists like in the other fields. And that prevents well, first of all, hallucinations that make generic AI really dangerous in clinical settings. At the same time, you're creating like this super dentist with experience. Then the second piece here is what I call beyond point solutions to complete intelligence. Like when you look at current AI in dentistry, well, first of all, these are fragmented. They are point solutions. So even if you look at, let's say, you focus on radiography, the current AI in dentistry will highlight problems on X-rays. If you look at what Isaac will actually do, it will think through cases and provide clinical reasoning. So we are building this super dentist brain also that connects to everything. It doesn't really look at one thing, but it will connect to your PMS system, to your imaging system. It's already connecting 1,500 payers. It'll connect to your inventory system, to your patient communication system. So you'll have one AI that handles clinical decisions, administrative tasks, and patient interactions really seamlessly. Now, that's the second piece. And the third one is what we call the network effect advantage. So every interaction with our 4,000 plus dentists makes Isaac smarter for everyone. It's like we're not training on people's data. We are simply making it better by looking, when AI or specialists look at these conversations, they literally know how to actually go and make Isaac better. They're not really training on patients' data. They're trying to figure out how to improve Isaac's response when they're responding to dentists. Then along that sort of network effect advantage, I mean, competitors, again, it's more or less sort of the same theme. Competitors are building isolated tools. We're building like this learning network where each practice benefits from that collective intelligence. Isaac will remember every conversation, every case, every preference, and create an institutional memory that never forgets. And then the fourth one, the last one, it's that what we call the AI native versus bolted on. So traditional dental software today, they try to add AI features. We are building the entire system around AI from day one. So we are building, well, things like natural language interface, like show me diabetic patients overdue for perio maintenance instead of clicking through like 15 menus. Isaac doesn't assist with your workflow. It is your workflow. And that's how we are, again, like rebuilding it from the ground up. Well, think of it this way. If I sort of have to summarize it, I mean, other companies are putting AI stickers on old software. So we threw out this old playbook entirely and asked, if we were building dental practice software today, knowing what AI can do, what would it look like? And Isaac is that answer.
I love that. As someone that I've been in dentistry for 14 years, I've been on the assistant side, I've been on the hygienist side, I'm now on the business side of it, the speaking side of it. I've probably been in over 500 offices in my career. So I've seen just about anything you can think of. And I feel like one question that I get asked all the time when it comes to AI is, why hasn't someone created something that combines everything all into one system? Like we don't have to integrate into multiple ones. We don't have to leave this page and go here. Like we can just have it all in one PMS, one interface. And now I get to say, well, it exists, right? I think that one, it's way overdue. It's needed. I think that probably one of the challenges that I see is maybe the dentist not incorporating it in a sense of they're a little afraid of it, right? They're usually worried about HIPAA. They're usually worried about it taking over, those pretty standard fears of AI, right? But I feel like you've mentioned before that one of the biggest hurdles was teaching Isaac to speak dentistry and not just process data. So I'd love if you could walk us through what that engineering challenge looked like and how our team solved it.
Yep, another great question. So I won't delve into sort of the proprietary information and how we do things, but I'm going to sort of talk to you about, the idea behind. The first idea is we want to move from what we call the oracle to a specialist. I mean, this is like the fundamental shift that we want. If you go back to foundation models like ChatGPT. They are what we call oracles. They know everything from poetry to physics, but they lack this really deep specialization. So what we didn't want was another Wikipedia for dentists. The goal here was to recreate the clinical intuition of a 25-year veteran practitioner. And the fundamental premise was Isaac should think like your most experienced colleague, not regurgitate textbook answers. That's sort of the first nugget here. The second one was like clinical wisdom versus academic knowledge. So real dentistry lives in the nuances, like when to deviate from textbook protocols based on patient factors. So what we wanted Isaac, to learn clinical pearls that only come from years of practice. Like if I want to show sort of more concrete examples like, well, this technique works better for anxious patients, or watch for this complication in diabetics. I mean, these are the things that you learn when you're on the ground, like boots on the ground. So what we wanted to capture this institutional knowledge that walks out the door when experienced dentists retire. The other thing that's sort of we wanted embedded in Isaac is what we call the safety first clinical reasoning. Simple example like drug recommendations. If you think about ChatGPT, it will happily suggest clindamycin without checking contraindications. Well, if you ask the same question on our platform, Isaac will automatically cross-reference black box warnings, drug interactions, patient allergies, and medical history before any recommendation. So every clinical suggestion goes through multiple safety filters that mirror how experienced clinicians actually think. And that's what we actually really want to embed into Isaac. And then the fourth point is what we call context-aware decision-making. So Isaac doesn't just know what to do, it understands why and when based on patient context. So it will combine clinical protocols with real-world constraints like insurance coverage, patient finances, practice capabilities, and then provide an answer. So it learns from thousands of similar cases to predict what actually work in practice, not just in theory. So the final word here is the breakthrough here is teaching Isaac to think like a dentist and not like a search engine. When you ask Isaac a clinical question, I mean, you're getting the collective wisdom of thousands of experienced practitioners filtered through rigorous safety protocols.
So I want you to put on your CEO lens for a moment, as that is what you are. When you think about the next 3 to 5 years, what does the success look like for Isaac and the company?
I think number one is industry standard adoption. So Isaac becoming the universal operating system for dental practices, like Windows for computers or iOS for phones. That's what success looks like. So dental schools teaching with Isaac as a standard curriculum with new graduates who can imagine practicing without it. And also when dentists say ask the AI, they mean ask Isaac. So we becoming the default intelligence layer for the entire profession. Like that's industry standard adoption. And then success is also having what we call profitable growth with integrity. So we're a venture-backed company. So we need to deliver exceptional returns to investors. But building a sustainable, profitable company that delivers exceptional returns to investors without compromising patient care is the definition of success. I mean, success means that we never have to choose between profitability and clinical excellence. So our business model at this point in time aligns both. So it's providing that healthcare AI that can be both transformative and also economically viable at scale. And then success is also about democratizing excellence. So it's like making specialist level clinical intelligence accessible to every dentist, regardless of location or resources. So we want to eliminate the knowledge gap between, let's say, urban specialists and rural general practitioners. At this point in time, we are delivering clinical intelligence freely. So our free clinical assistant ensures basic AI support. That basic AI support reaches every practitioner who needs it. Maybe the last point here is social impact at scale. So once we are truly profitable, we all agree to dedicate like 1% plus of resources to underserved communities. And it's not really, again, that's not charity, that's really responsibility. So we want to use our platform to expand quality dental care access where it's needed most. And success means our commercial growth now directly translates to improve health outcomes for those who need it most. If I sort of summarize, like, again, true success in healthcare AI is not only about market dominance or financial returns. It's fundamentally improve how care is delivered. And when a rural dentist, let's say in Montana, has the same clinical intelligence as a specialist in Manhattan, when administrative burden stops preventing patient care, when our success enables us to serve underserved communities, I mean, that's when we'll know that we've succeeded.
Absolutely. I think that's incredible. I especially coming from my heart to yours because I work in public health. I talk about human trafficking outside of artificial intelligence, and I can always go back to that core belief of I know I've done my job if I've helped at least one person. That's we're succeeding if we're giving back. We're succeeding if we're making it easier for the profession to wake up, go to work, see their patients, and at the end of the day, they're not depleted, right? They're not wanting to quit dentistry. We have so many people in our profession that are so burnt out. And I think that anything that we can provide that actually helps them and actually makes it to where they can get back to being a human being themselves and treating human beings in the same way, I think is going to be incredible. So I'm very, very excited about that. What excites you about how Isaac will transform the lives of dentists and their patients, kind of what we're talking about?
Yeah, excellent question. I mean, as a technologist, seeing technology actually serving people brings joy. I mean, there's pure joy in watching thousands of practitioners embrace technology that genuinely makes their lives better. I mean, we are giving, and that's the ultimate goal. I mean, we are giving dentists their evenings back, their confidence back, and their passion for dentistry back. So when a dentist tells us, Isaac, help me figure out something today that I would have missed. I mean, that's a life potentially changed. So that's one angle, and then the second one is what I would call the ripple effect of better care. So every dentist using Isaac becomes a better clinician. It is 10xing every dentist. I mean, that improvement now touches every patient they see, even when they see the patients for decades. So we are multiplying that clinical excellence. Like one AI improvement benefits 4,000 plus dentists at this point in time who treat hundreds of thousands of patients. And this compound effect now is staggering. Like small improvements in decision making create massive improvements in population health. That's what I call the ripple effect of better care. And then the other point is we're eliminating the anxiety of uncertainty. So a lot of dentists suffer in silence when they're unsure about complex cases. Isaac gives them confidence to provide optimal care, and ultimately patients get better treatment plans because their dentist has access to collective wisdom and not just individual experience. There's no more, I mean, in the heads of dentists, there's no more, I hope I'm doing this right moments. Isaac will provide the clinical backup every practitioner deserves. And then also one thing, and changing, I mean, I've been exchanging messages on LinkedIn with people around the topic of we are making dental care more human by introducing AI. I mean, this is like it's a little bit of a paradox here. AI makes dentistry more personal by freeing administrative burden. So you have more time for patient conversations, education, relationship building. So when the technology can handle the routine, humans can focus on what matters most. And in this case, it's caring for people. What gets me up every morning is knowing that like Isaac is literally like changing lives. Like every practitioner who gains confidence, every patient who receives better care, every practice that rediscovers why they love dentistry, well, that's the real transformation.
Absolutely. As a clinician myself, I can tell you there's definitely been times over 14 years and all the different practices where I'm just walking in and I wish that there was at least a baseline protocol or some kind of North Star that everyone followed and then went from there because AI is meant to be a tool, right? And we're still the final decision makers. But I feel like that's something that Isaac can significantly help with. It's like, okay, at a minimum, let's look here first, and then let's build off of that as a team or what have you. But I feel like the emotional piece of it as well, in terms of having like a mentor in your pocket of there's some things I don't want to go to the dentist to talk about, right? I maybe want to have more of a private conversation or get advice in more of a private way or not seem like there's something I don't know to my boss or something like that. Or there's something that a patient asks and I'm like, I haven't learned about this in 8 years. It's not that you're not a good clinician. It's just there's so much we have to know. You can't take every CE everywhere all over the world to the second that it's, been presented, but AI can, Isaac can, right? And I think the more that we learn how to integrate something like AI and like Isaac into our day to day and help alleviate a lot of those pressures, the whole industry will be better for it.
I couldn't agree more with your statement.
So I feel like for many of our listeners, which are going to be clinicians, what would you say is one thing that they should know about using Isaac in their operatory today?
Yeah, and I want to touch on maybe one or two points that you mentioned, and that comes up very, very often. Like people think that when we are designing the AI, we are designing a system that's going to replace them. And that's not what we are building today. When we say your AI copilot, I mean we stress that it's an AI, it's a copilot. We didn't say that we were actually designing an AI pilot. Your AI copilot is not your replacement. So Isaac is designed to amplify your expertise, not replace it. And you can think of it as having the world's most knowledgeable dental resident who never gets tired. You make the decisions as dentists, and Isaac provides the intelligence, the clinical judgment, but the clinical judgment always stays with the dentist. So what we are building here is that human AI symbiosis where both becomes more effective together. That's what we are building. And then also we've built an empathy-driven AI that really understands your world or the dentist world. So Isaac actually gets that dentist or anyone in the dental practice is frustrated when insurance denies a claim, stressed about a complex case or overwhelmed by admin work. It actually does understand this. So it's not only geared towards clinical intelligence, it really understands the emotional reality of a dental practice and does respond accordingly. So we have a lot of people who have used Isaac, maybe as a therapist or a confidant, and Isaac really does really understand again what's going on. So it's really designed at the core by dentists who felt every frustration that you as a dentist have. So we've built Isaac to be also the colleague we always wished we had.
Right, right. That's
And
100% needed. I cannot tell you how much.
yeah, and also I want to tell people that, well, Isaac is available when you need it most. So if it's like, and we also had that, like people are 2 a.m. are worried about a patient and Isaac is there. You have a complex case and you need a second opinion, well, Isaac is ready. There's no judgment, there's no ego, there's no scheduling conflict. You're getting reliable support whenever uncertainty strikes. So your practice gets smarter every day as Isaac learns your preferences and patterns.
I love that. And I can only imagine what it's going to do for the burnout side of dentistry as a clinician and then just friends of mine that's the one thing that we all complain about, right? It's like we go a day full of dentistry and we're just depleted by the end of it because there's so much that goes into it. Like you're taking on their emotional stress. There's some people that don't want to be there, or don't like you because they don't want to be at the dentist. But then we also have to think critically, right? The critical thinking side of dentistry is just, it's so difficult sometimes, meaning there's so many different elements that we're having to think of in order to think critically for the patient, whether that's comorbidities or preference, you name it, or allergies. Is their insurance going to cover it, even though we shouldn't have that mentality, but at the end of the day, we do, right? So I want to thank you again for sharing your perspective and joining us.
And if I may sort of wrap up again, I
Mhm.
feel like I have to actually say these things like sort of over and over so that people get it. I'll say it one more time. Like Isaac isn't about replacing also the human touch in dentistry. It's about giving you the confidence and support to be the best clinician you can be. So we are here at Trust AI to handle the burden so you can focus on what you love most about dentistry, which is caring for patients.
Absolutely. I love that. I'm so glad that you are here for episode 1, and we're kicking this off with a great foundation. I want to thank all of our listeners, and we will see you guys next time.
Awesome. It's been fun.
Thank you.